are not safe for long-term ulcer treatment. Proton pump inhibitors are some of the most commonly prescribed medications worldwide, especially for managing conditions like peptic ulcers. They work by blocking the stomach's acid production, which helps ulcers heal and prevents new ones from forming. When used for a short period, usually up to 8 weeks, they are generally considered safe and effective. Most people experience minimal side effects, such as headaches, diarrhea, or stomach discomfort, which are usually mild and temporary. However, the question of long-term safety is more complex. Some studies have suggested potential risks associated with prolonged PPI use, including low magnesium levels, increased risk of bone fractures, certain infections like pneumonia, and possibly some gastrointestinal cancers. It is important to note that most of these findings come from observational studies, which can show associations but do not prove cause and effect. The actual clinical significance of these risks remains uncertain because high-quality research is limited, and the overall risk for most patients is low. In clinical practice, long-term PPI therapy is typically reserved for patients with severe or recurrent ulcers, or those who cannot stop using medications like aspirin or non-steroidal anti-inflammatory drugs that increase ulcer risk. Guidelines recommend that, after about 8 weeks of treatment, healthcare providers should reassess whether continued therapy is necessary. Many patients can stop or switch to on-demand use once their ulcers heal, reducing unnecessary exposure to the medication. It is also common for some patients to be prescribed NA beyond what is needed, sometimes without a clear ongoing indication. This can lead to unnecessary long-term use, which should be avoided. Regular check-ins with healthcare providers are essential to evaluate whether continuing PPI therapy is still appropriate. For patients requiring long-term treatment, monitoring for potential side effects is advisable, but serious complications are rare when the medication is used appropriately. Overall, when used correctly and for the right reasons, NA are considered safe for long-term management of peptic ulcers. The key is careful patient selection, regular review of the need for ongoing therapy, and balancing the benefits of preventing ulcer recurrence against the small potential risks. Always consult your healthcare provider to determine the best treatment plan tailored to your specific needs, as individual health circumstances can vary widely.